If your knee randomly buckles, feels wobbly on the stairs, or just gives out on you when you least expect it, this video is going to explain exactly why that's happening, and more importantly, what actually fixes it. Hi, I'm Dr. Chris Garcia, founder of Sports Performance Physical Therapy and meniscus pain relief expert here in San Diego. And I want to walk you through a pattern I constantly see in my clinic every single week. Now, this is incredibly common in active adults who've stayed fit and active for years and don't expect their body to suddenly feel unpredictable. Now, if that's you, I want to say clearly, this is not a sign that you're falling apart. It's a specific mechanical problem, and once you understand what's really happening, the path forward gets a lot clearer. It almost always starts the same way. You tweak it, you twist it, maybe on a hike, maybe reaching down for something, maybe just getting out of the car. It's sore for a few days, so you ice it, you maybe wrap it, you take it easy for a bit, and then it feels fine. So you go back to the normal activities, pickleball, the gym, chasing the grandkids around the yard, whatever makes your life feel like your life. And then, usually when you least expect it, the knee buckles again.
Ah! Ah! Ah!
And this time it's worse. Maybe you almost fall, maybe you do. And if that sounds familiar, you're not imagining it and you're not alone. So here's what's happening actually in plain terms. When the knee swelling goes down and that pain finally fades, it feels like you're better. Your brain thinks no pain and the problem is solved. But feeling better and being healed are two different things. The meniscus is a C-shaped cushion of cartilage that sits between your thigh bone and your shin bone, and it does two important jobs. It shock absorbs and it helps stabilize the knee so it doesn't shift or wobble when you move. Now here's the tricky part. The meniscus has poor blood supply, especially through the outer 2/3 of it. Tissue with poor blood supply doesn't heal the same way that a cut maybe on your skin would. So even when the symptoms calm down, the tear itself is very often still there, quiet, waiting for the right amount of load or the wrong step to remind you it's actually never healed. And this is exactly why bracing, rest, or just being more careful only gets you so far. A brace supports the knee from the outside. Rest calms down the inflammation, but neither one rebuild the strength around the knee joint, and neither one address the structural tear sitting inside it. So people end up in a loop. They feel better, they go back to activity, the knee goes out, they rest again, they feel better, they go back to activity for months and even sometimes years. And then every trip through that loop tends to chip away a little bit more at your confidence in your own knee.
Hey, McQueen, you all right? Listen, don't you worry, pal. You had a good run. Enjoy your retirement.
Storm takes back the lead.
Unbelievable! McQueen is fading! McQueen is fading!
And so what actually needs to happen are a few things that work together. First, we need to know exactly what we're dealing with, where the tear is, what type it is, and how it's affecting the way you move. Second, we need to rebuild the strength in your thigh and your quadriceps and your hamstrings, because a strong, well-coordinated knee can absorb an enormous amount of stress that a torn meniscus simply can't handle on its own. And in a lot of cases, regenerative therapy, such as shockwave therapy, both radial and focused, and EMTT help support that healing process directly, working alongside that strength work rather than replacing it. Shockwave therapy uses focused acoustic energy to stimulate blood flow and encourage that tissue to remodel. EMTT uses a pulsed electromagnetic field to support that same process at a cellular level. And the two are often used together for exactly this type of injury. Now, once that tissue and that strength are both moving in the right direction, we load back up gradually, the right way, so it actually trusts itself again instead of just tolerating activity until that next flare-up. If your knee keeps doing this, buckling, giving out, catching you off guard, I wanted to give you a chance to schedule a free discovery call with me and my team. We'll look at exactly what's going on with your knee, talk about what you've already gone through, what you have already tried, and put together a real plan to get it strong and trustworthy again. The link to book that call is right below this video. It's completely free, there's no pressure, and it could be the turning point for your knee. I hope to talk to you soon. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.